AATTV is a platform designed to promote services, individuals, and programming that can support people in their recovery journey before and after they have been discharged from addiction treatment. The overarching goal is to help bridge the gap between the finish line of treatment and the starting line of sustained recovery outside the treatment setting. The psychoeducational video content is crafted to connect with patients on a practical, actionable, and solution-focused level. It recognizes that treatment is not a one-size-fits-all approach, and patients should not be funneled into programming that does not align with their specific needs. This programming is designed as a living document. It can evolve and grow alongside the changing needs of patients and their families. Clinicians are encouraged to contribute content based on their own strengths, further enhancing the relevance and effectiveness of the programming. The underlying belief is that better-informed patients and families make better-informed decisions about aftercare and early recovery. While nothing can replace face-to-face support, AATTV aims to utilize all available resources to deliver impactful messaging to people at various stages of their recovery journey. There is a clear need to reevaluate and refocus the programming curriculum and social media strategy to better represent the true nature of the services and care Ashley provides. By refining their online presence, Ashley can better showcase their commitment to delivering exceptional, cost-effective care to those seeking addiction treatment and recovery support. Essentially, an online library of psychoeducational material capturing the element of the fun-loving energy of caring and healing at Ashley. In the field of substance use disorder treatment, updates should be carefully measured and implemented to consistently uphold the highest standards of care. The goal of this interactive information system is to foster continuity, coherence, and effective communication. By providing patients and staff with up-to-date, comprehensive knowledge, it empowers them to provide and receive high-quality, consistent care that prioritizes the needs and well-being of patients navigating substance use recovery. Phase 1. Patient-focused content. This phase focuses on delivering relatable, comprehensible, and actionable content to support current patients in their recovery journey. Key elements include videos explaining what to expect during treatment, recommended items to bring or to not bring, information on anti-craving medications and how they can support recovery, information on how aftercare recommendations are made, explanation of the levels of care and why it is important in early recovery. Detailed overview of Track 9, what it is, how it works, and why it is utilized in the treatment approach. Videos on foundational recovery information such as home groups, sponsorship, available resources, apps to support recovery, meeting etiquette, emotional sobriety, acceptance, and surrender, and how to utilize a recovery support network. Videos with non-traditional approaches focusing on emotional identification, utilizing media as ways to convey messaging and stimulate thought. The Father Martin Files, a comprehensive collection designed to bridge the gap between long-term alumni, financial donors, and demonstrate the institution's evolution over the years. Carefully curated segments of Father Martin's renowned videos, broken down into purposeful, short, and incremental segments to convey impactful recovery messaging. By preserving and sharing Father Martin's influential teachings, this phase aims to honor the facility's roots, inspire current and future patients, and strengthen the connection between the institution, its history, and the recovery community it serves. Phase 3. Family-focused education. This phase aims to provide psychoeducational material for families of those suffering from addiction, including resources and information on the disease model of addiction, guidance on how aftercare recommendations are developed, details on anti-craving medications, an accessible resource hub for families to access support and information as their loved ones navigate recovery. The overarching goal is to equip both patients and their families with the knowledge, tools, and support needed to foster successful, long-term recovery outcomes. Phase 4. Post-discharge patient support. This phase focuses on providing psychoeducational content to support patients after they have completed their treatment program. Key elements include alumni support resources such as in-house produced meditations using campus imagery to promote continued growth, synopses of important literature and novels rooted in addiction and mental health recovery. It Works, If You Work It Wednesdays, featuring photos of recovery tokens celebrating patient sobriety milestones. Progress Not Perfection podcast, highlighting staff spotlights and insights. The overarching goal is to foster sustained recovery and continued connection to the Ashley community post-discharge. Phase 5. Staff Training and Development. This phase encompasses psychoeducational material for staff, including detailed policies, procedures, and best practices, in-depth coverage of evidence-based treatment approaches, opportunities for continuing education and professional development, new hire and new patient orientation to ensure consistent, high-quality onboarding. The aim is to equip staff with the knowledge, skills, and resources needed to deliver the highest standard of care aligned with the organization's core values and principles. Phase 6. Research Publication. This phase is dedicated to the publication and dissemination of research conducted within the Ashley Treatment Facility. By sharing the data-driven insights and innovative practices, the goal is to provide patients with confidence in the program's evidence-based approach, position Ashley as a leader in the forefront of substance use disorder treatment, contribute to the broader field and advancement of addiction science and recovery. The overarching vision is to leverage Ashley's research capabilities to inspire hope, inform best practices, and drive continuous improvement in the treatment of substance use disorders.